quick discussion on only the recommendations of Rcog, GTG for hypothyroidism in pregnancy. So for this, we are going to do this under three headers. That is the pre-pregnancy state, and when the patient is diagnosed in the pre-pregnancy state and she is being treated, and while she is receiving her treatment, she conceives. And then there's a scenario in which the patient is diagnosed newly during her pregnancy, and then we have the post-natal or postpartum management. Okay, so for subclinical hypothyroidism, in the pre-pregnancy scenario, we are going to depend on the TSH level, and our target TSH level is less than or equal to 2.5 milli international unit. Now, in this case, if the TSH is more than 10, if it's less than 10, but it's more than 2.5, or the lower limit being the more than the value for that trimester, because there's a trimester specific range that we should know. Or another scenario in which the TSH is normal but PT4 is decreased. That's separate. Now, in this case, when it's more than 10, then we're supposed to titrate it to levothyroxine such that our value becomes equal to or less than 2.5. So for this, scenario, we are going to give levothyroxine, and if it's less than 10 but more than 2.5, then particularly if TPO antibodies are positive, then in that case you are supposed to commence treatment. For this scenario, they have not definitely said that treatment is recommended, but they have said that it's better to start treatment specifically if the TPO antibodies are positive. Now the patient is receiving her treatment and her UPT becomes positive, then of course we are supposed to increase the dose of levothyroxine by 25 to 30% till 5th week of the gestation. So for that, the best way is that the patient should already be counseled to self-increase her dose, and the easiest way is to double the dose on 2 days of the week. Double the dose on 2 days. And the next plan or the another option is that considering her current dose, if her dose is less than 100 microgram per day, then she's supposed to increase it by 25 microgram per day. And if it's more than or equal to 100 microgram per day, if her daily intake, then she's supposed to increase it by 50 microgram per day. Okay, 50 microgram per day. Now this was simple. Now what's the third scenario is that she was not already diagnosed. Right now we just saw the pre-pregnancy scenario, that what's our target TSH if she's willing to conceive. What happens if her UPT becomes positive while she's receiving treatment? How to increase the dose? Now, what if she is diagnosed newly in this pregnancy and she was not already a known case? So in this scenario, we are supposed to start levothyroxine, but the dose should be known. Again, we're going to divide it that TSH is more than 10 and TSH is less than 10, but greater than the trimester specific range, or greater than 2.5. So now if it's more than 10, then we are going to commence treatment as soon as possible, just the way we did in the pre-pregnancy scenario. We started treatment as soon as possible, trying to reach our target. But over here, the dose is given, it's 1.6 microgram per kilogram per day, and we're supposed to repeat TFTs after 4 weeks. Okay, but if her TSH is less than 10, more than 2.5, then in this case, you have two options. Now they say that it's better to commence treatment, but it's not absolutely recommended, or you're not supposed to start it as soon as possible. You're going to consider it, and it's better to commence it. Okay, 1 to 1.2 microgram per kilogram per day. But if you're not starting treatment, then you can just choose to monitor. And it's based on your own clinical assessment and decision. And if you're monitoring the TFTs, then you're going to do them at 4 to 6 weekly intervals till 20 weeks. And after that, you're going to do them once at 28 weeks. Okay. Now, what happens after birth? So, just like for GDM, we're supposed to step down. In this case, we're also supposed to step down. So, if she was already on thyroxine and her dose was increased, then after birth, within 2 weeks, she is supposed to return to the pre-pregnancy dose. And if she was not on any treatment, and she was started on treatment, then they say that she is supposed to, within 6 weeks, she is supposed to stop treatment, and we are going to send the TFTs after 6 weeks. So the TFTs are supposed to be sent after 6 to 8 weeks. It's not 4 to 6 weeks, it's 6 weeks. Or if you're supposed to talk about a range, then it's at 6 to 8 weeks. Okay, so it's a very simple and easy algorithm.